Our current healthcare structure is built on diagnosing illness. I want to flip that paradigm. I want to help you build health so that we're not, providing snake oil and telling you to rub mud on yourself if it's not going to work. We want treatments that work, that are true and doable. I don't want change to be daunting. I want change to be doable. Alive Lifestyle Medicine is a practice of lifestyle medicine as well as direct primary care. It's Missouri's premier location for bridging lifestyle medicine and internal medicine. So it's for people who want to use lifestyle medicine to both treat and prevent their diseases while also having a place of direct primary care where they can feel welcome, open, non-judgmental. I'm not going to browbeat you and be able to build a shared goal of where you want to be with your health, and then use evidence-based treatments and lifestyle interventions to get there. And that's going to be tailored to everyone. You're going to have a different need than me, and somebody else might have a different goal. And so figuring out how that works in your practical life and also what you're willing to do and in what time frame. And so I want to be able to walk with you through that and kind of cut through a lot of the noise that we hear on the media and on social media, and just be able to give you options based on the evidence. Evidence-based medicine allows us to apply what we know now for optimal health. I think back on the history of healthcare, and physicians used to recommend some pretty crazy treatments, which not only weren't helpful when we tested them, but actively caused harm. And so I want to apply the level of, is this true, will it help, and what's the data, to the choices we make now. For example, with breast cancer, we know that there is a genetic component, but even with the genetic component, we can help reduce the risk of people getting that. We can help reduce the risk of recurrence. We can help people have less risk, even without genetics, to not get breast cancer. We know those data, and figuring out how to apply those in our practical life is important because we ought to demand the truth from the treatments that we are offered. And sometimes we're not offered because data can be behind medical practice about 17 years. So if a study came out this year, it takes about 17 years to be incorporated into the medical standard. And so when it comes to lifestyle medicine, I don't want to be behind, and I don't want my patients to be behind. And so that's the approach to evidence-based medicine, so that we're not, providing snake oil and telling you to rub mud on yourself if it's not going to work. We want treatments that work, that are true and doable. And the doable part is where we can figure out how to take the data and apply it to your life. Patient plans are tailored based on your goals and where you want to go, and figuring out the data and discussing it and saying, for you, is it worthwhile giving up this or doing this in order to get there? That's going to be different for everyone. And sometimes that can be medication, sometimes that can be lifestyle changes. So you may not go all the way with the great choices, but even small nudges can make huge impacts in your overall health and longevity. Some of the smallest changes you can make end up having drastic effects later on. So figuring out where you want to go and what your goal is a great start. And then figuring out a map, right? So maybe you can start making changes 6 months from now, but be able to think about where you want to go, and then think about the smallest change that you can make today. Maybe it's eating an apple a day. It may be different for someone else. It may be going on a walk 5 minutes a day. That doesn't sound like much, but that adds up. And so those small incremental changes add up. Maybe it's calling a friend and having lunch. Yes, that is lifestyle medicine. So those small changes are things that we can figure out where to start and how to build on. I don't want change to be daunting. I want change to be doable. I want to be able to provide health care, not sick care. Our current healthcare structure is built on diagnosing illness. I want to flip that paradigm. I want to help you build health. It's not that we won't talk about disease. It's not that we won't treat it. That's going to happen. We live in a world where things can happen, and even reducing risk doesn't eliminate everything. So the more healthy you are, the less likely those things are to happen. And we know how to do that. The science is very clear how you can build health. Make yourself less likely to get severe COVID, less likely to get a heart attack, stroke, and cancer. We have the data. What we don't have is a good structure for us to be able to help people do that. And so that's why I've done this paradigm shift here, so we can focus on the things that help you live longer, live better, less disability, and are happier. And to do that, we had to shift the structure. And that's why there's a teaching kitchen behind me. That's why we're going to talk about how to implement those things in practical, doable chunks that can build up over time. Small changes can have long-term differences. When you think about investing, your health is like that, only even more so. And so by flipping that to focusing on building health and relationships, we're able to plan for the future and to see that it's a good future, not I'm going to look forward to being in sick care. And so sometimes you need places where it's focused just on sick care. I've utilized those, I've practiced in those, and those are certainly appropriate. But in your day-to-day life, when you're working on building health, having a paradigm where health is the focus and we work on building that and dealing with other things as they come along is really what you need to have long-term success. An average follow-up visit for a patient of my direct primary care minimum is 30 minutes. I don't schedule any appointment less than that because I think that you deserve the time, and I want to make sure that we can hear each other and make decisions together. When establishing care with me, whether it's for a lifestyle medicine consult or for joining the direct primary care, we block 60 to 90 minutes of time. It's important to do that because we need to make sure that we're able to explore your history, your goals, your physical exam, and to be able to make the plans for the future together. Food is medicine. We are just beginning to understand what it looks like and how it works. Whether it's broccoli with the sulforaphanes that actively affect cancer, or turmeric with the active component of curcumin, we know in research trials they make a difference. And so figuring out practically, okay, that's the trial, but how do I practically apply that to my life? That's where I can come in and help you figure out those pieces. And we have data coming in all the time now that we're actually studying this more. And so food is medicine, and it's figuring out how to use the food as medicine. And so when I look at a plate, I see a plate of things that are telling my body what to do. Is it telling my body to repair itself? Is it giving it the data it needs to switch my epigenetics to a favorable position? Or is it flipping the switch and telling me, oh, it's time to be inflamed, your gut's leaky, oh, now you feel bad. So your food is information, not just energy, and figuring out how to use the data to feed yourself and optimize your future health is important, possible, and I can help you with that.